SARC Talk. SARC is a nonprofit cancer research organization that develops and manages clinical research trials in pediatric and adult sarcomas. SARC Talk is a podcast to discuss activities of SARC, interview sarcoma research leaders, and review scientific initiatives in the sarcoma field.
Welcome to SARC Talk, episode 31. My name is Scott Okuno, medical oncologist at Mayo Clinic and chief medical officer of SARC. At SARC, we talk and interview interesting people who are connected to sarcoma, where we can all share and spread the knowledge about sarcoma. Today, our guest is Lachelle Semanko, executive director of Rein In Sarcoma. Rein In Sarcoma has a three-pronged mission: educating, supporting, and funding research. Lachelle has worked at Make-A-Wish in Minnesota for over 20 years and came over to Rein In Sarcoma as executive director a couple of years ago. She's a native of Minnesota and she has a passion for sarcoma, and she continues to move forward the mission and the vision of Rein In Sarcoma. And it's our pleasure today to welcome Lachelle.
Thank you.
Yes. So today, we're here learning a little bit about not only Rein In Sarcoma, but today is a very special, or this month is a very, very special month, and it's Sarcoma Awareness Month. And because of that, we just wanted to touch base with one of our main groups that we engage with, and you and I, Lachelle, have engaged quite a bit as in the past. But maybe, Lachelle, share a little bit about your audience, about yourself, and how you came to Rein In Sarcoma.
Yeah, well, thank you so much, Dr. Akuno. I'm Lachelle Semanko. I came to Rein In Sarcoma through, I would say, a mix of personal passion and professional purpose. My background is in nonprofit work, and I've just always been drawn to mission-driven organizations. So you mentioned I have a experience at Make-A-Wish, and when I was there, I had worked with many, many children who had sarcomas. So I've been familiar with this type of cancer for decades. And when I learned about Rein In Sarcoma and just the incredible impact it was having on sarcoma patients and families, I knew it's where I wanted to be. Shortly after I joined the organization, just over 2 years ago, my 11-year-old cousin Carter was diagnosed with osteosarcoma. So he is currently battling a recurrence. And so I would just say, sarcoma is a cause close to my heart, both professionally and personally. And it's just a privilege to work alongside survivors, caregivers, and advocates who are deeply committed to changing the narrative around sarcoma.
Perfect. I love that. And, many of us, at least I'm from Minnesota here now, essentially my adult life, and I know about Rein In Sarcoma, but your group is definitely expanding, not only from Minnesota outward, but maybe you can share with our audience a little bit about the origin story of Rein In Sarcoma and kind of the plans that you have for Rein In Sarcoma.
Yeah, of course. So Rein In Sarcoma was founded right here in Minnesota by the late Karen Wyckoff and her family. After Karen was diagnosed with synovial sarcoma at the age of 19, she had this vision of raising awareness, funding research, and supporting others who were going through a similar journey. In her words, she hoped for a world without sarcoma. And so, what began as a small gathering in a park, now known as our annual Party in the Park, has grown into a national nonprofit with deep Minnesota roots. And we're proud to carry her legacy forward as we expand and reach and support more people across the country.
Great. I know that Rein In Sarcoma is a little bit unique because many of our organizations are very histology specific. Even though Karen had a synovial sarcoma, her vision was to eliminate sarcoma, period. It's not just synovial sarcoma. Um, because of that vision, there are three pillars that Rein In Sarcoma has, or what we would say three programmatic themes. And maybe you can share with our group, because there might be other organizations that are looking towards this as well as Describe a little bit more of how Rein In Sarcoma works on the three pillars or three major programmatic themes.
Yeah, that's right. So, Rein In Sarcoma supports all types of sarcoma, and our mission has the three pillars. It's education, patient support, and research funding. So, um, we collaborate with other sarcoma-specific foundations and organizations locally and nationally, whether it's working together on strategies for things like clinical trials or awareness campaigns. We're sharing resources, supporting patients with rare subtypes. We believe in the power of working together. So, sarcoma is too rare and too complex for us to work in silos.
You brought up the word again, rare. Sarcomas are extremely rare. As we say, it counts for 1% of all malignancies. In the state of Minnesota, it's estimated in total, maybe 400 to 500 total cases of sarcoma. So it's really hard to get people interested or aware of these rare tumors, yet alone the diagnosis of sarcoma, specifically like your family, osteogenic sarcoma or Karen Wyckoff's synovial. What are programs that you guys are doing at Rein In Sarcoma that will help impact and improve the awareness of sarcomas in the community as well as us in the healthcare industry? Because I don't want to call it industry, but what are the programs that you're doing to say, don't wait till you get diagnosed, but you guys are doing some unique things to get earlier in our training?
Yes. Yes, so raising awareness about a rare cancer it's a constant challenge, but it's also something we are creative and passionate about. So some of our key programs include our Sarcoma Scholars program, and that is for medical students. This is actually our fastest growing education program. This year, we will have had more than 100 medical and advanced practice students come through this program. So essentially, we train a cohort of students from universities all across the country each year on everything they need to know about sarcoma. So we call it Sarcoma Boot Camp. After that, the scholars present about sarcoma to their medical student peers. They complete a sarcoma related project and they volunteer with us throughout the year. So we find that this is a way for upcoming doctors and researchers to take that knowledge into practice by knowing the red flags of sarcoma for early detection and then knowing kind of how to treat patients and what therapies are available. We also educate the public through public campaigns and community events, including partnerships with media. We host webinars, attend and exhibit conferences such as Rare Disease Day, Rural Health, and many other conferences such as that. Our website is a wealth of information with expert videos, patient stories, and red flags information. So, early detection is key, and that's kind of the message we try to get out.
Perfect. I'm just going to follow up one question about red flags. You said it a couple times. You and I know a lot about it, but it might be important for those that are listening is what is the red flags and what is that campaign?
Yeah, so we like to call it our lumps, bumps, and bruises campaign. And so if you have a lump, bump, bruise, or pain that um, won't go away or it's growing, you should have it checked out by a doctor. Those are typical signs. It's not all the signs, but those are some common signs of a sarcoma. And so it's better to have it checked out um, because you have a better outcome if it's detected early. And you, as a sarcoma specialist physician, I would love if you have anything to add to that as well.
Yeah, no, that's exactly correct. And trying to train individuals and also other healthcare professionals, there's certain warning signs that we think could be nothing, but however, something that needs to be done. And Six Flags, the red flags. I'm thinking of
Yeah.
amusement park all of a sudden. Anything bigger than a golf ball. So I think all of us know what a golf ball size is, and I think there's a big push to say is anything bigger than a golf ball needs to be evaluated by an expert and move forward with advanced imaging if appropriate. So we're excited about that. And that brings us to the main reason why we're here, and other reasons, but main reason is this is July of 2025. And what is very unique about July, Lachelle?
Sarcoma Awareness Month.
Okay, tell us
Wearing
a
my
little bit
yellow.
about sarcoma awareness. So you got your yellow. I should have worn my yellow. My
Yeah,
gosh. Yeah. Oh,
yeah.
by the way, I purposely brought it. Um, this is the documentation of the red flags, and this is the
Yeah,
golf ball, and this is
yeah.
what we try to hand out, and this is what I got from Lachelle and her team about Rein In Sarcoma. So those that are watching can see me holding a golf ball, and the tag of the discussion about when is a lump and a bump and a bruise something that needs to be evaluated. So if you are interested in getting more of these, just reach out to Lachelle. But to
Yep.
that point, Lachelle, this is Yellow Month. Go ahead. Tell
Yep.
us Sarcoma Awareness Month.
Yeah, yeah. July is a big month for us, in not just in Minnesota, but beyond. We are hosting our Party in the Park, which is our signature event celebrating survivors and remembering those who we've lost. This year is actually our 25th birthday, so we're calling it Birthday Party in the Park this year. It's a big milestone for us. It's kind of part family reunion, part awareness rally, part fundraiser, and we expect over 500 people from the medical community to be there and help support. So that's a big event coming up for us. Uh, this month, we're also doing a campaign on social media called Rein in the Facts. So putting facts out, red flags to be aware of. We're doing some ads with media, and we have a state proclamation to officially secure State Sarcoma Awareness Day. And we're sharing inspirational patient stories throughout the month. We're collaborating with some other sarcoma organizations to encourage some legislation at the national level around clinical trials for rare disease. So it's been a busy month.
Awesome. And for those that might not be familiar or remember, our governor in the state of Minnesota is,
Tim Walls.
yeah. So Tim Walz did declare Sarcoma Awareness Month July. So it is a proclamation, as you say. So we're really excited. And as you can tell from Lachelle and her team, they're not only reaching out in Minnesota, not only for those families and healthcare providers that have been impacted by patients and their families, but also trying to reach out to engage other people across the United States and legislator because it's important to get the word out. So July is Sarcoma Awareness Month, and for those that are sarcoma, what is our color for sarcoma?
Yellow. Yellow.
Yellow. So as I said, I think it's exciting. I, I do know, and you've highlighted that the party in the park is only one aspect to celebrate, and get people aware. Um, but fundraising is a key part, and in our environment now more than ever, fundraising is hard. And maybe you can share a little bit of the efforts that you are doing to ensure that the mission continues and that the funds that are going into patient care, navigation, as well as these events, but also funding research. So you've done and maybe you can share like how much funds you've actually contributed over the course for funding research and how you're developing more development dollars.
Yeah, yeah. I mean, you're right. So fundraising is essential in order to, in additional to traditional donor research or outreach, I'm sorry, we host events like our gala fundraiser. We have a golf event, Party in the Park, of course. We also have partnerships with businesses and foundations and a strong base of monthly and annual donors. We have a very passionate board of directors who leverage their networks to help us raise funds. We have a unique program called Named Funds, where a person or family can create a fund in honor or in memory of someone impacted by sarcoma. We've got over 60 named funds. Those families raise money each year to fund for the fund of their loved one, and then we honor and recognize those funds throughout the year. So it's really an amazing program. and way for family members to honor a loved one and make a difference for others. We emphasize transparency and impact so our community knows exactly where their dollars are going, like you said, to research, our support programs, and education initiatives. And we have funded over $2.5 million directly to research. And a lot of that is kind of seed money that has then encouraged additional funding. Last I heard was over $14 million in additional funds generated.
So it's an exciting aspect. And, this is just 1 month. This is an organization that's been going on for some period of time. And you highlighted too that you've reached out beyond Minnesota. You have other groups that you're doing the what we call Rein In Sarcoma Scholars to help medical students be aware of sarcoma and spread the word. Um, how far is your reach going to be as you move forward? Because this podcast will hopefully reach more people, and if they are interested in an organizational connection with you, we'll give links, or to this. Megan will give links to it. But how would they get in touch with you if there's an organization, sarcoma center or medical center, that wants to develop a relationship with Rain and Sarcoma?
Yes, we would love that. I mean, just you can reach out to me directly and we can chat about the opportunities to partner. You can check out our website. It's reigninsarcoma.org, and there's information there on our scholar programs, our research grant program. We are deeply connected to the sarcoma medical community. Our research grant program funds projects mostly close to home right now at the U of M, Mayo Clinic, Children's Minnesota, as well as we've got some donor advised funding to projects across the nation. And even our first international grant was given last year to the University of Calgary. So we are looking to expand our research funding as well as our Sarcoma Scholars program. So currently, we have connections with our scholars at medical centers, University of Minnesota, Mayo, University of Wisconsin, Medical School of Wisconsin, University of Iowa, Florida, University of Michigan, and then a number of other advanced practice programs in Minnesota. So we are looking to expand, and if anyone else is interested, please reach out to me. We also provide we partner with medical centers to provide newly diagnosed patient guidebooks and just other resources. So our aim is to make sure that sarcoma is not just seen, but it's understood by everyone from frontline providers to future researchers.
That's exciting things, and I know that your team is working hard at that. And I know it's a small team, but very effective team. And hearing what's going on and the breadth and depth that you guys are doing, an outstanding program that you guys have built out. So as we get to the end here, it's July, Sarcoma Awareness Month. Is there anything specific or what other additional messages you want to leave our audience with today?
Yeah, I would say, sarcoma may be rare, but the people affected are not invisible. Every patient matters, every story matters, every dollar, conversation, and act of advocacy brings us one step closer to better outcomes and hopefully a cure. So, whether you've been personally touched by sarcoma or you're hearing about it for the first time, there is a place for you in this movement. And like I said, you can visit the website or reach out to me directly, and I'd be happy to chat with you.
No, we appreciate that. And like your message, Lachelle, is you're not alone. There are other people who have gone this journey and that we can help be with you during your journey of sarcoma. And hopefully it's a positive one. So we got to end with a big positive note here that we have a lot of people committed to supporting July Sarcoma Awareness Month, not just in July, but every month of the year. Any additional thoughts, Lachelle, as we close?
Yeah, I mean, lastly, just I guess if there's one thing I'd love for people to remember is early detection saves lives. And so While July gives us a chance to turn up the volume, sarcoma patients need our attention all year long, like you've mentioned, and Rein In Sarcoma is here for the long haul to support, educate, fund breakthroughs, and we welcome anyone who wants to participate in this mission. Thank you for listening today.
Well, Lachelle, thank you for your time, your dedication, and your passion. And yes, we hope that we'll continue to support Rein In Sarcoma and other sarcoma organizations, as you said, you collaborate as well. So July is Sarcoma Awareness Month, and we do appreciate everybody continue to remind that sarcoma is out there and that we need continued voice out there amongst all the other uh, tumors that are out there. We think we're one big special snowflake, and I know Lachelle does think we're that way too. And let's keep the message there, not only in July, but long term. So thank you, Lachelle.
Thank you for having me.
Thank you. For those that are listening, we appreciate this. If you have any comments, please submit them, and we look forward to our next podcast. So thanks, everybody.
Thank you for listening. Be sure to subscribe so you never miss an episode of SARC Talk. To find out more about SARC, please visit our website at sarctrials.org. To suggest a topic or for questions, please email us at sarctalk@sarctrials.org. Together, we can find a cure for all forms of sarcoma.